Mediated conversation on SAFM.
27 minutes now to 9 the time for your media's conversation this Thursday morning. So as the winter months start to press in on us, you can already start to feel that cold and flu season is here. If you listen very closely to your radio, from time to time you'll hear how someone's voice is not quite as strong as it should be or as clear, and for the first time in 2 years, people are reporting that they cannot come into work because they have some kind of flu or a cold, which is not related to COVID-19. At the same time, we're still generally inside wearing face masks, which may protect us from germs and flus that we're used to before COVID. But we're also not done with the pandemic yet. It is still with us. And some people are now very worried about monkeypox cases, which have been found in Europe and this week in Nigeria. So then, what is the disease outlook for this winter? We've invited the epidemiologist, and of course you know him, he runs the CAPRISA Center, Professor Salim Abdool Karim, to put it all together for us. Professor Abdool Karim, good morning and thanks for your time this Thursday morning.
Good morning, Stephen. Good morning to all of the listeners.
Firstly, we seem to be in a position where COVID-19 cases are still being found in hospitals, and it seems that there are not many of them, but if you look at the official figures, we still see that people who have been diagnosed with the disease, with COVID, are actually dying. Is COVID still killing people in South Africa? Let me put it, I suppose, that bluntly.
Yes, unfortunately, that's still true. In fact, yesterday there was an analysis of the U.S. data published in the New York Times that showed how in the elderly, even the Omicron variant, which we know to be a milder form of the virus, is still causing a very large number of deaths. In fact, in the U.S., there were more deaths in the elderly from Omicron than there were from Delta. In South Africa, we had our initial Omicron outbreak with a subvariant called BA1, and that started in December of last year. By late January of this year, a new subvariant, BA2, started spreading in South Africa, and BA2 replaced BA1 by March of this year. Now, we are at this stage in the midst of our fifth wave, driven by BA4 and BA5. Both these variants seem to be milder, just like the original Omicron, and they have caused what I call a mini wave. And what we have seen is that the cases went up quickly and now they are on their way down. But the number of admissions is still quite high, and we have seen the deaths rise very slightly, but they have risen. So yes, Omicron is killing people, but not to the extent we were seeing, a year ago.
So if we look at the excess deaths figures, are they what you would have expected for this time of year before COVID, or is there a difference to what we had before the pandemic? And I realize, excess deaths doesn't tell you everything that's happening, but it's an important indicator.
Yes, I think excess deaths it's a catch-all, because excess deaths refers to all causes of death that are over what is expected. So we don't know the actual cause of death in the excess numbers. But in South Africa, our excess deaths are on the high side of what we would expect. So it's just above the level of expectation. So we are seeing slightly more deaths in the region of around 200 to 300, I think, if I'm not mistaken, more than we would expect. We get several thousand deaths a month, and there's a small proportion that's higher. Now, what's causing those deaths? It's quite likely that some of those are related to COVID-19, but it's also likely that we will start seeing deaths come up for a range of other diseases. And right now, we are in the midst of a wave of infections from a virus called respiratory syncytial virus, RSV, which occurs largely in little children, and it causes a few deaths each year in South Africa. It causes a bit of a pneumonia in children. So that's what we are seeing at the moment.
Is it also possible, and this is going to be, I think, an impossible question to answer, but maybe we should start the conversation, that our excess deaths this year may be higher for causes that are the results of the pandemic, but not directly related to it? By which I mean, I would suggest that many people are poorer than they were before the pandemic, and as a result, their chances of them dying are higher. In other words, our excess deaths, our baseline excess deaths figure may need adjusting as well. There are lots of things that are connected to the pandemic, but not necessarily just a medical reason for a death.
I mean, that's quite possible, but I think when we look at the excess deaths, we first look at what is the level of expected deaths. And the expected deaths is taking into account the last 3 to 5 years of deaths that occurred in each week. So week by week, we know what the expected average number of deaths is. And that takes into account all the causes of death, motor vehicle accidents, drug abuse, gender-based violence, all the multiple causes of death. Now, if we are going to see an excess deaths from other causes, is unlikely to be at the levels we have been seeing for COVID-19, because COVID-19 comes in these waves and the excess deaths just shoot up. If we are seeing excess deaths from other causes, they won't be related to our waves. We will just see a slight increase that persists over time, unrelated to the COVID waves. We are not seeing that right at this time, but we could see it in the second half of this year for a range of reasons unrelated to COVID.
It's 20 minutes to 9. It's your mediated conversation on SAFM. We're speaking to the epidemiologist, Professor Salim Abdool Karim, talking about colds and flu season this year, which is related to COVID, but not directly, well, not really related to COVID, depending on how you look at these things. Professor, during the pandemic, it seems to me that if you had a cold or if you had flu, you almost certainly had COVID. I can't think of any person I know who was unwell during the pandemic where it was not COVID. And thank goodness, because COVID took so many people. What was happening to what I would call the usual colds and flu during COVID?
It was quite striking, Stephen. So when you look at our data from 2020, we expect to see an increase in deaths due to respiratory syncytial virus in children that normally occurs in the second quarter of each year. And by the time we get to mid-year and the third quarter of each year, the deaths due to influenza start rising. In 2020, we had neither. We had, in fact, in the second quarter of 2020, we were way below what the expected number of deaths were. In fact, we were saving large numbers of lives in the second quarter of 2020. And we think that that was principally because the lockdown, the social distancing, the sanitizing, and the mask wearing, all of those combined, prevented our respiratory syncytial season. And of course, we had no flu in 2020. Because of all these measures, we prevented the usual flu season that we see in our winter. Now, flu causes somewhere in the region of 7,000 to 10,000 deaths per year, largely in the elderly. And we just didn't see those in 2020. And in 2021, again, we had barely a flu season. But we are expecting that that's going to change this year, because now we're not following most of those restrictions. And so we will now expect to see our influenza season for 2022 come about. So that's why we're advising people, please, especially the elderly, please go and take your flu shots.
So there's no, I don't know what the right word is, virology reason. There's no reason related to COVID-19 that stopped another flu virus from coming. It was just the precautions. Is that what you're saying? Because the theory was at the time that COVID was that season's flu.
No, it doesn't quite work like that. Flu has its own dynamic, and it will the immunity that you get from flu doesn't really preclude or interfere with the immunity you have against COVID and vice versa. So you can quite easily get both infections because they are unrelated to each other. They're very different families. So it was not that because we had COVID that we didn't get a flu season. It's more likely that it's the precautions that we took for COVID that led to that. Now, it should be pointed out that when we have been in our earlier waves of infection, if you have any respiratory symptoms, it's COVID until proven otherwise. Common things in medicine occur commonly. So if you have a respiratory illness while we are in the midst of a wave, we go on the basis that, it's most likely to be COVID. So we may be missing a few cases, but it's unlikely to be the case because we have 2 surveillance programs that just routinely monitor for respiratory viruses. One is done by the NICD and one is done by Lancet Labs. And in both those laboratories and both those surveillance programs, we didn't see a flu epidemic in both 2020 and 2021.
So, obviously people will be treating the situation now very differently. You'll go into some businesses, you'll still be scanned, you'll still be sanitized, you'll still wear a face mask. I'm sure if you go into others, that's not quite the case. But most people probably are still wearing face masks indoors. If we now have a rise in cold and flu season, does that mean, face masks surely haven't just stopped working, it's all about our behavior?
Yeah, I think, flu is not just spread by respiratory droplets. It's interesting in that flu also spreads with hands. So actually, hand sanitizing makes quite a good contribution to preventing flu. So if we continue sanitizing and wearing masks, we will pretty much blunt this season's flu. And right now, the number of cases of flu that we have is still quite low. But we haven't really gone into our winter season yet, so we would only really expect it to rise this month. But up to now, in the routine surveillance that's being done, we have very few cases of flu. So it hasn't hit us yet. Whether these restrictions that we're currently following are going to help us keep flu at bay and, prevent, close to 7,000 to 10,000 deaths in this year, like we did in the previous years, it's too early to tell.
So there was an argument that came from, I don't know what you would call them, the anti-lockdown campaigners. Let me sort of put them in a very broad category so that they can tweet me about it. And they used to say, treat COVID like flu. I think they were wrong. The evidence, I think, shows that they were wrong. But there's another way that you can look at this, which is that you could say, if we lose 10,000 people every year to flu, we should treat every flu like we treated COVID. In other words, keep the sort of precautions that we've been having in society over the last 2 years, keep them sort of permanently or every winter. I think that would be quite a big burden on society, but I could see that argument progressing.
Yeah, so there is a difference in that with flu, we can expect that the vast majority of our deaths will occur among healthcare workers and mainly the elderly. So in my view, we need to be taking very similar precautions to what we did for COVID in the home for the aged. So in institutions that have large numbers of elderly people, we need to take the same kinds of precautions. And really, they're threefold. The first is to make sure everybody is vaccinated against the flu, because vaccination is pretty good against the flu. And the second is to just ensure that you're continuing your hand sanitizing, especially for visitors and healthcare workers in the homes for the elderly. And then, of course, mask wearing indoors. If we do those three things, we are likely to mitigate the vast majority of the deaths that we would normally see in a flu season. So we don't need to do all the other things for COVID. And just to reinforce your point, Stephen, that there is no question that COVID-19 is not anything like flu. I mean, how do we know that? It's very simple. If you look at the excess deaths, we had about 100,000 excess deaths from COVID-19. We don't get 100,000 deaths from flu. So there's just nothing to compare between the two. We also, at a global level, it's estimated that the first 2 years of the pandemic led to about 20 million people dying from COVID-19. There's no such thing in flu except when we had the 1918 Spanish flu. So the normal flu season is nothing like COVID-19. COVID-19 is in its own league. To give you, to perhaps put it in context for people who still, want to insist that it's like flu, is if you take 2 years of the pandemic of COVID-19 and 20 million deaths, the entire 40 years of the HIV pandemic caused about 45 million deaths. So HIV, which we all recognize and accept as a major medical catastrophe, caused 45 million deaths over about 40 years. In comparison to COVID-19, it caused half as many deaths just in 2 years. So there is no question. COVID-19 is nothing like flu.
Such a strong point to make. You were there, SAFM. It's your mediated conversation. We're speaking to Professor Salim Abdool Karim about, well, COVID, colds, and flu. They're not biologically related or chemically, virologically related. He is getting himself into linguistic trouble, but they are having an impact on our society. You were there, SAFM. We will continue in a moment, 10 minutes to 9.
SAFM.